Dr. Rossi, shrinksandsneakers.com. In this video, I'm going to talk about my new series, and it's going to be called New Medication Monday. So what we're going to do is try to drop a new medication video each Monday, talking about the new mechanisms and old tricks. Basically, what are the medications that are in the pipeline for psychiatry, why I'm excited about some of these medications, and why I think other people should be excited about these medications as well. So let's go ahead and crack right into the first of these examples. So I want to start by talking about the medication KAR-XT, which is a combination of Xanomeline and Trospium. So this is a combination drug of Xanomeline and Trospium. So those things might not mean much to you because they're kind of complicated names. One of the things I always hate about the drug design is they always come up with a relatively complicated name for their medications. But anyway, what is Xanomeline and what is Trospium, and why should you be excited about it, and what are we doing with it then, and how are we using it to treat patients? So the story begins with the muscarinic cholinergic system, and I want to back up to the nicotinic cholinergic system, which was something that was thought to play a role in the disease schizophrenia. And the reason behind this was a lot of our schizophrenic patients smoke cigarettes, and not only do they smoke cigarettes, but they smoke a lot of cigarettes. Generally, they're chain smoking. They're smoking like 1 pack or more per day. So it got people interested in the idea that there must be some benefit. There must specifically a cognitive benefit to smoking and nicotine and stimulation of those nicotinic receptors. So people got very interested in this, and they did some research. They designed a few drugs, but all those things really didn't pan out. It didn't go as well as we thought. And again, the thinking process was that this may have some cognitive benefit and that it may help with negative symptoms of schizophrenia. So the cholinergic system from the nicotinic cholinergic system didn't pan out. But the interest now is on the muscarinic cholinergic system. So these are different types of receptors, and I'll get into the types of receptors in a minute. So this has been of interest for a long time. The other reason the cholinergic system seems to be of interest is because many of the drugs we use to treat dementias or neurocognitive disorders like Alzheimer's disease are acetylcholine esterase inhibitors. So what that means is we're inhibiting the breakdown of acetylcholine in the brain, and that's allowing for more acetylcholine to be available. And we know that acetylcholine is one of the main neurotransmitters involved in cognition and seems to be involved in a lot of these neurocognitive disorders. So again, taking that information and trying to sort of extrapolate it to schizophrenia, you can think that there would be some benefit to potentially stimulating some of these receptors for cognitive enhancement in patients dealing with schizophrenia. So this is kind of where the ideas have come from. What I'll say about these muscarinic receptors is there's 5 different muscarinic receptors, M1 through M5, and these are different from the nicotinic receptors in the sense that these are metabotropic or G protein coupled receptors, and the nicotinic receptors are ionotropic. So basically what that means is there's a G protein linked cascade that goes on in these metabotropic receptors versus the opening of an ion channel when the nicotinic receptors are stimulated. So different type or mechanism going on there when these various receptors are stimulated. So Xanomeline as a medication is a little more specific for the M1, M4 receptors, and it's going to stimulate those receptors or act as an agonist. And you might be saying, well, okay, Dr. Rossi, what does that mean and why do we care? So again, stimulating these receptors has demonstrated benefits in clinical trials for both positive and negative symptoms of schizophrenia. The M1 stimulation improves cognition in the prefrontal cortex. So stimulation of the M1 receptors in the prefrontal cortex leads to enhanced cognitive function in patients with schizophrenia. And then the stimulation of the M4 receptors in the subcortical areas helps to maintain dopamine homeostasis. So essentially what's going on here is that you have a cognitive benefit by stimulating the receptors that are located in the prefrontal cortex, the M1 receptors. And then you have the added benefit of controlling dopamine because we we know the primary hypothesis for schizophrenia is what we'd call a hyperdopaminergic state, meaning the person has excessive dopamine levels. So controlling that or modulating that is primarily the way in which we treat schizophrenia right now, and in particular those negative symptoms. Now, most of the drugs we have currently are dopamine blockers blocking the D2 receptors. So this is a completely different way of controlling dopamine or maintaining dopamine homeostasis than we've seen with other mechanisms of action. So that's why it's exciting from the perspective that apparently stimulating M4 receptors has a benefit for both positive and negative symptoms, right? Now, Xanomeline itself has a lot of side effects. So if you were to give this drug by itself, or this medication by itself, the person would experience essentially what is the side effects of excessive cholinergic stimulation. So the person would end up having things like nausea, vomiting, GI distress, diarrhea, excessive sweating, and salivation. And the side effects actually were intolerable. So most people could not continue the medication with these side effects by itself. So the pharmaceutical company got clever and they added this additional medication called Trospium. So what Trospium does is it acts as an antagonist in the periphery. So it blocks the peripheral muscarinic receptors. Now, why is that important? Well, that's going to essentially negate all of the potential side effects of this medication. And the other good thing about Trospium is it does not cross the blood-brain barrier, meaning it doesn't act centrally. So it's not going to block the effects of Xanomeline once the Xanomeline enters the brain and the central nervous system, right? So once you get into there, it's going to be fine because, again, Trospium cannot cross the blood-brain barrier. But it's going to negate all of those peripheral side effects from the stimulation of muscarinic receptors in the periphery. So all that nausea, vomiting, diarrhea, sweating, salivation, that's going to be taken care of by the Trospium, and the Xanomeline will be free to cross the blood-brain barrier and stimulate those M1, M4 receptors, resulting in enhanced cognitive function by stimulating M1 in the prefrontal cortex and M4 in the subcortical regions, leading to improved dopamine control. So again, very interesting mechanism of action. This is a new mechanism, one that we have not seen before used in schizophrenia, and it's interesting to see that it's already demonstrated benefits in clinical trials for both positive and negative symptoms. You might have guessed it would help with negative symptoms and cognition because it's working on the cholinergic system. However, it also seems to help with positive symptoms as well. So we're going to cut more videos like this. If you guys are interested, if you like these videos, please like and subscribe to the channel, and we'll continue doing new Medication Monday with the latest and greatest meds in psychiatry.